type webinar, because there's only a few people on, that will get your questions. We can really talk, I think, today about your questions and how things are going. Let's go to the next one. So I want to begin today, so a general agenda that we're going to go through today. Since there were some ARIS Act issues, Charles, our programmer, is in the room, and he's going to kind of walk us through the ARIS Act update and make sure that we're all up to date on what's going on with the programming.
Okay, hello, this is Charles. So the ARIS people down in Madison were able to release a final update for the app that was causing us issues of things being way too small. And so now we're able to use this new app. I would encourage everybody to be on the latest version of the iOS operating system and also the latest version of the ARIS app. And we are currently styling all our scenarios and PC games to take best advantage of those things. So all the scenarios are usable in their current form, and we're working to make minor improvements to how they all look in order for them to look exactly how we want them to on the new app. So make sure all your devices are updated with the latest operating system from Apple and the latest app from ARIS, and we should be good to go. If you have any questions, our website has a frequently asked questions area, or you can email us any questions that are problems that you might have.
Anyone have any questions for Charles related to ARIS or the ARIS app? And stay safe, you don't have a microphone, so if you have any questions, just type them in. All right, well then we're going to move forward. So today our focus is really to kind of walk through our two newest storylines, which is pediatric pain and end of life. So there, I want you to pull up the, down below, let's go with pediatric pain, the one that says 1A at the end. Yep. We're just going to walk through the documentation a little bit. I'm going to start with level 1, and then I'll kind of highlight what's different on the other levels. You can kind of shrug that down just a little bit. Not that way. So some highlights to, most of you remember our pediatric pain because it was the first couple of scenarios that were released. We have updated it a little bit from the prior release documents, and so we kind of want to walk through them a little bit and let you know what's different and what you can expect. So we're going to watch the documentation. All of our pediatric pain management scenarios are nursing related. And for each level, I think this is the first time we've done it, for each of the levels up through level 4, there is both a level 1A and a 1B. And the reason for that is that one of the scenarios will have a live family member required for the scenario to work really well, and the other will have the video version of the mom included. So for 1A, this is the one that will require the live family member. Basically, on the front of the sheet, you can see the scan to begin code. You can tell that it'll take 30 minutes to run and 30 minutes to debrief. And basically, it's a lot like our first scenario. Paula was in a car accident, and she came in the hospital about 24 hours later. They did a CT scan that was negative, so she's just there kind of getting some pain management and making sure she's okay and that she doesn't have any surgical issues. If you want to go forward. You can see the learning objectives and the curriculum mapping. Since this is a level 1, this is really predominantly about patient assessment and focusing on those patient assessment skills. And what's nice about this one is it is a pediatric patient, so it allows students to kind of get those skills on that population as well. Keep going. Yep, keep going. The next section of the documentation, as a reminder, is all about the simulation learning environment and setup. This will guide the technician and or the faculty as to how to set Paul up appropriately. It should be a pediatric mannequin if at all possible. She is age 7. So somebody small, but really no mirage is required other than that at this point because we will use the QR codes for everything within the scenario. In general, she presents fairly stable in level 1, but she is having some pain at this point. You'll notice in level 1, you can include some optional things for Paula to make the scenario more real. So you can include some things that a 7-year-old might like, coloring books, music, a phone or a tablet of some sort, a teddy bear or a doll or something that would make her feel more comfortable, things that might make the scenario more real for a pediatric patient, things they may have, maybe a blanket. Anything can be added to kind of up the realism a little bit. You also notice in level 1, because nurses are where they are at in the curriculum, that they can't give much for medication, so we opted to go for suppositories in this scenario since she is an abdominal patient. We didn't want to give her oral meds until after everything was clear. You'll notice that this is an opportunity for students to have some exposure to the suppository options for medication. And there's the QR start code. These are the ones that you can cut out and use for the scenario as we go forward. So the teaching plan just highlights everything that you would do in the pre-brief. This is a lot like what we've gone through on the other webinars. But basically it's letting you know that in our scenarios we start in the pre-brief room with all of the students together with one iPad, ideally projected onto a screen in the room so that the students can all view it as one. This is where they will scan the start code, and then they will meet their patient. And this is a video of Paula. She cries a lot in this one, but it is a video of Paula so that we can understand exactly what she would look like and how she's feeling before the scenario starts. And then at this point, you can walk through the different aspects of how the scenario will work for your students. So you'll want to walk through how the leveling up works, what the tabs are within the iPad itself, what the orders are. You want to walk through the medication QR codes that they must scan a patient ID prior to giving any medications, or the iPad won't let them do it. And then you want to highlight the fact that the medications have a hyperlink on them so that they can go to the website, or the Daily Meds website, and actually get their interactions and make sure that the medications are working okay. Any questions so far? Once you've walked through how the simulation will work using the iPad, we're going to move on to discussing the learning objectives, and then going over those, we will get reports, which means there is a nurse video that will give us a report as to what's happening with the patient. There's some questioning that we can do with that, and make sure that everything is good with the students and that they're fully prepared to go through the scenario. At this point, we're almost ready to go into the patient's room and start the scenario, but we usually like to give students 5 to 10 minutes to review the chart to make sure that they know what's going on prior to going in the room. And the chart is all the task content within the iPad. So for state 1, you can see that the chart will contain the H&P. It'll contain a full H&P that highlights what happened in the emergency room when she came in. The orders are here as well, so you can see this is what's ordered for the patient. That will be on the order tab within the iPad, as well as tomorrow will be the next thing you see. You'll notice that you can see on here that the medications are underlined or hyperlinked within the iPad. You can see in the daily record tab the last set of vitals. And then the vitals screen is the one that allows students to enter the vitals as they take them within the scenario. If you notice for the next several, there are no reports available, and that's exactly what it says on the iPad. There are no progress reports, labs, or imaging available in this level. The level tab really just lets both the user and, most importantly, the facilitator know where the student's at in the scenario. So in some cases, if you kind of get lost in the middle of the scenario, you could go to that level tab, and it'll tell you where you're at, and then you can go back and figure out maybe a step that was missed in order to advance to the next state of the scenario. The scanner's within there, and then all of our scenarios contain an exit tab, which allow you to exit the scenario at any point, knowing that all the data will be lost, just that you can exit at any point and start over, or just if you've gotten to a point where you think that you need to end the scenario before ideally it's ended. So at this point, students go into the room and they begin their assessment of the patient. And really, what you see here is they're highlighting how the patient will feel. She is whiny, she's complaining, she doesn't want to be there, her belly hurts. And that lets you know what to expect from the students and how we can proceed going forward. For this level, really we're looking at students wanting to accurately take vitals for this pediatric patient. So we did, if you'll notice under there, that we set some ranges. So those are the vitals that they must enter in order for them to be correct so they can't continue. And this way, as a facilitator, you also know that they're actually getting the vitals correctly and that they've done it in the way that they should. They're also going to perform an abdominal assessment at this point. And when they scan the QR code for the abdomen, they will see seatbelt bruising on the abdomen. That is one of the features of the augmented reality in this scenario. And then we're going to spend some time really talking to that patient and making sure she's okay. If you go down to the technician prompt, right underneath that, so this is the technician telling you how the patient will feel, but right underneath that there's actor prompts in this one. So remember, all of our levels that have an A after them require an actor. So this one lets the actor know, or the role player, whoever it is that you want to play that role, maybe how they should respond to certain scenarios or certain situations when the nursing student is talking to them. There are various descriptions of the action that they could come up with, how they're worried about their daughter, different scenarios that they have. And then right below, if the students decide to ask any detailed questions about how Paula's experienced pain prior, here's some answers for those questions to kind of set the tone for how Paula normally reacts to pain. And so this is something that you could give your actors and role players to help guide them through the scenario prior to going in there. And that would really help guide the scenario towards the directions that we're looking for. And then, just like with everything else, there's possible facilitator questions. We can go through and talk about how we assess the pain and how we handle Paula in this first set of the scenario. Right below that, you can find the tab iPad prompt below, and that lets us know what we need to do in order to move to the next state of the scenario. So, in order for that to happen, to move to state 2, the students must correctly scan the abdomen, and then they have to enter vitals correctly, and that will allow the iPad to automatically advance to level 2. And keep going past that. In level 2, really, this is about medication administration. If you remember back that they had a choice between acetaminophen and morphine. And this is really about students trying to use some critical thinking skills as to which medication of the two available would be best, or if they would like to call the physician for something else. So in this one, she is not only having some pain, but she's worried about the fact that she has to have the medication in a behind. And so there's some therapeutic communication that needs to be done with that. And then students really should be thinking a lot about whether or not those medications are appropriate to handle their pain. Is acetaminophen going to do what it needs to do, or is morphine the better option? Or if they're looking at surgery, if they start questioning why not oral, maybe they're looking at surgery and CT scans along the way and making sure that all those results come back negative. So really that's what the question is about in critical thinking as to which medication may be most appropriate in this situation. Or do they want to call the provider and maybe get another option, such as intranasal fentanyl, for example, is a commonly used medication. Okay, you can keep going. But really, this first level really highlights patient assessment and therapeutic communication, and that's really what a lot of it is. And hopefully, with the actor prompts and the facilitator questions, this helps guide faculty as to different areas that they can pursue, not that this is all inclusive by any means. You want to go one more time? In this, when the change from level 1 to level 2 in the iPad, you'll notice that imaging has resulted. Students are not prompted to this, so it may be beneficial at some point for the facilitator to guide the students towards that, but the imaging report does come up showing that the CT was negative at this time. So if students are questioning whether or not to give acetaminophen or morphine, in addition as to whether or not oral would be appropriate or how they would talk to the provider, this may be something that they would want to know prior to doing any of that. Keep going. And that's really all there is to the first set of pediatric pain management. As the other levels progress, in level 2, They're in level 2A, the one that requires an actor. We are going through the scenario involves the mom being inappropriate, mom or dad actually, being inappropriate and or verbally abusive, and so the students have to really deal with and handle that situation and what would be best as far as calling social services, etc. And level 2B, since our actor is a video actor, we really can't get that across on the screen as well. We opted to go for some booster seat safety and more patient education as to how we would handle this in the actual situation when a child is 7 with always seat belted in the back and not in a booster seat. In level 3 and 4, the patient actually did have a perforated bowel, so she is arrived back from surgery. And both levels focus on surgical assessment and PCA management, as she has a morphine PCA that was started in the OR. Level 4, actually, when they arrived to the room, the night nurse had increased the PCA and given IV Benadryl for some itching, and the patient is less responsive. Her respiratory rate is very low, her oxygen saturations are low, so it allows students to deal with the crisis and have to administer the IV naloxone and then have to try to make sure the patient is stable, call a physician. We can also institute a rapid response. And then we have actors. We have some tips with some actors in there, role-playing for a respiratory therapist and a physician to come in to help manage the airway and make sure the patient's stable. And then there's some therapeutic communication involved with that if her mom is not present when she does finally wake up. Does anybody have any questions about the pediatric pain storyline or how the documentation is working? Oh yeah, that's enough. Okay, so let's walk through then the end-of-life scenario. We'll do this really briefly. I think we've gone through the documentation enough to know a little bit about how it works. If you want to pull up the nursing laptop, yeah. What's noted about the end-of-life scenario, this is our other new storyline that's been released, is this one not only includes nursing, but it also includes the ENT paramedics. So we do have 2 different sets of levels to go through on this. Each of them has 4 levels within. And really, without going back through all this documentation all the way through again, I want to highlight what happens in each of them for both nursing and the paramedics. In the nursing scenario with end of life, it really is about the patient is comes into the hospital. In the first couple levels, the mom still wants everything done while the patient has been placed on hospice and is ready to go through the end of the life stages. She's a 35-year-old end-stage lung cancer who has been sick for quite some time. She's been placed on hospice, and it's really about the students going through the advanced directive options and being able to not only go through them with the family member, but with the patient as well, and getting all those decisions made. So level 1 is about assessing the patient. There is this level 1 stage 1 pressure ulcer on their sacral area that they're going to deal with, and then they're going to go through palliative care consultation and the filling out of her advanced directives, all of which are located on the iPad. There's both a blank copy that you can fill out with the patient during the scenario, and then a completed copy that is located in the later stages of that level 1 scenario. In level 2, she is already a DNR, but some of the orders have yet to be kind of resulted through. They did get ABGs in the middle of the night, which allows students to interpret some ABGs because the mom is still insisting that she wants everything done. She's having lots of pain, so they're addressing those concerns with palliative care and making sure that they're getting pain under control. In level 3 nursing, the patient is no longer verbally responsive, and really this is all about therapeutic communication with the mom and trying to help the mom through this stage of the patient's dying process as she is actively dying in stage 2. And then stage 4, the patient, when they go to the room, has passed. And in this stage, it's really about all of the forms and paperwork associated with end-of-life care. It's about calling the coroner and about taking care of all of the paperwork that is needed at the end of life. In our paramedic scenarios, it's really, these ones are kind of interesting in that the paramedics actually, we did the video shoot in a home. So paramedics arrive on scene after being called to Laura's home, where her mom is also present. So really, with the paramedics, it's all about using what they do according to their national registry. And they walk in, and level 1 is all about scene size up, and they're really looking at the scene and making sure the scene is safe for them and kind of getting an idea of what's going on. Level 2 is actually going into their first assessment of the patient and getting a generalized view of what's happening there. Level 3 is continuing that assessment, and level 4 is all about transport. And in the end-of-life scenario here for the paramedics, level 4, the patient actually has passed, and it's about them having to figure out what to do in those scenarios as well, and providing care for the mom at the same time when the patient has advanced directives in place and has chosen to not have anything done. So any questions about the end of life? At any time, if anybody has any questions about the documentation or anything for the new scenarios, whether it's pediatric pain or end of life, or even the older scenarios as we run through them, please don't hesitate to contact either Tim or myself. We'll be glad to run through them. Just send us an email, and we'll be glad to run through or kind of get you through any sticking points that you may have. All right, I'm going to bring that PowerPoint back up. Go through. Next one. Okay, so this is kind of you guys' time. I know there's only 2 people on the line, but it's really your time to kind of let us know if there's any successes or sticking points that you'd like to talk about, or any issues that you're having that you would like us to address.
This is Carmen from Medical Solutions. I just was looking on the website to kind of see if it's changed. Is it on the website? Is it available there or just in the locker?
It should be on the website.
It's not. It'll be added by the end of the day.
Oh, okay, yep, it'll be added by the end of the day. We just realized it wasn't there.
Oh, okay, great. Thank you.
You're welcome. Anyone else have any questions, anything they want to talk about related to the ARISE project? Okay, I'm reading your chat. Okay, I don't have any, we were working on my source. I just got a chat from one of the people over my phone, but there's some resistance at the college as far as getting the scenarios implemented. You know, that's been, I think, a general sticking point for most people is that this is a change in maybe the way that it was done. A couple of things that have worked really well for us at CVTC regarding that is really kind of guiding people through the process, first of all, and then kind of making it clear that these scenarios, although they have some augmented parts to them, they really are supposed to run just like every other scenario that there is. So you're supposed to still run them like any other scenario. It's just we've added some video and other things to help the scenario be more real for your students. Other things to keep in mind is doing it as a group works really well. So the first couple times if you run through it as a faculty group can work well. That kind of helps alleviate some of the issues that are happening later. I know that's worked with a couple of us here at the college. We ran through it with a few people just to kind of get some ideas as to what the issues were, and then it helped. The other thing is, since it is involved technology, some people get really scared that technology is not going to work. And there are times when that does happen. It is technology. We all know that happens from time to time. But keep in mind and tell faculty that we've created the documentation in a way that if something were to happen, servers go down, your college's website activity isn't working real well, you don't have connectivity, that the documentation, you could run this scenario of just print the documentation out and give them the orders and the HMP and everything they need, just like you would have other scenarios. It will still work, it'll still run, you just won't have the videos and some of the augmentation with it. So that could take that scary part away. You just keep running with it as you would before. I hope that helps a little bit with some of the resistance, because it works really well here at CVTC. Although it is still an ongoing issue, that probably will be that case, as everything that's new tends to have a little bit of obstacles in overcoming. Question will ask in the meeting, what day is the discussion on STEM content? February 9th?
February 9th, yep. So that'll be the second day of the 2-day meeting.
Any other issues? So this is really your time for question and answers. Anything that you want to know from us? All right, well, David, did the group have anything else to add?
Nope, it's probably a light day just because of the time of year and getting started with classes, but we really wanted to go ahead and hold it just in case you needed anything from us getting started for the semester. I would say don't hesitate to give us a call or send us an email if you have any questions.
Yeah, let us know for sure. If you go to the last PowerPoint slide too, let Kim and I know for sure if you have any issues as to where to implement things. Again, go to our website. Make sure that you have registered and log in. That's how you see the scenarios on the website. Otherwise, they're all available on WIZ. I want to remind everybody to have students and faculty complete the surveys as they go through. That really helps us know what to work on and what's working well and what not. And then again, I don't have the biannual up here, but I think everybody has those dates. But here are the next webinars following the biannual and what we'll be discussing. So we'll be really excited at that point to be able to walk through our pediatric asthma, which is our latest scenario that we're working on. It's not released yet, but it will be released by that time. So again, if you have any questions, please let us know. Otherwise, thank you so much for taking time out of your day today.
Okay, thank you so much.
Thank you. It didn't look like it, and there was, I think that we had a caller use